where can we protect ourselves in our buildings? It's not necessarily just healthcare facilities, but office buildings, retail, any place where there's large gatherings of people, owners and end users and engineers are starting to question, how can we better protect people from airborne diseases and flus and viruses by monitoring and looking at how we're addressing our indoor air quality. Unfortunately, it takes events like we're in right now to move the needle and create change. We saw this many, many years ago with Legionella and how we're looking at water treatment and things like that. And I recently read a great line, and I think it's very, very prudent to what is going on right now. And we've addressed a lot of water quality issues in the past, and we're still looking at that. But the line is, we don't drink contaminated water. Why do we tolerate breathing contaminated air? And this really shouldn't just be a focus right now because we're in a pandemic, but it should always be. As an engineer myself, when we're doing design, we're always focused with indoor air quality, especially in the healthcare market that we're in, making sure that all occupants of those buildings, especially the immune compromised and the people in there for treatment, don't have to worry about the quality of the air that they're exposed to. So as an engineer, it's always been a concern, but now it's just on the forefront because more people are asking more questions and they want to protect themselves, their occupants, their patients, their workers, and also protect themselves from any types of legal ramifications that might come through in terms of if somebody's in your facility and they get sick, or your facility becomes a super spreader of something bad, whether it be coronavirus or something else that might come down in the future. So we always want to look at indoor air quality.